If you're a sleep dentist that wants to use dental sleep medicine as a means to pull away from general dentistry and start handing off more of the day-to-day to an associate so you can practice something that's a little more fulfilling and a little less taxing on your body, you're probably not going to be very successful with that unless you have some sort of system in place that allows you to attract sleep patients to your office. Now, you might have a thriving dental practice, okay? But the reality is that there's just not enough new monthly patients for you to screen in order for dental sleep to be able to provide the means of pulling away from general dentistry. The bread and butter of general dentistry is still what's supporting you. It's supporting your staff. So if you want to pull away from that, you have to have that system in place. Now, I want to introduce you to Dr. Pinsky. Dr. Pinsky came on with us in November of 2019. He was doing pretty well in sleep. He was doing around $137,000 a year in sleep. 1 year later, after COVID, after all of that mess, in 2020, he did $257,000. And in 2021, he's on pace to do over $500,000 in sleep. And he is now hiring an associate, pulling away from general practice to focus on sleep and select surgeries that he really, really enjoys. If you want to do something similar to that, like I said, you have to be able to leverage some sort of system that allows you to transition your focus away from general dentistry. Now, I can't explain everything about how to do that on this video, but if you click the button somewhere around here, you can access a training that we put together that will go through step by step how you can begin to implement key things that will allow you to pull away from general practice as you scale your sleep practice. So again, I want to introduce you to one more doctor. This is actually Dr. Cuffy York. Dr. Cuffy York actually sold his general practice, and he opened up a brand new sleep office in a brand new city, had not had a single conversation with any local physicians. And within his first 30 days of working with Dental Sleep Profits, he was able to close $20,000 in sleep appliance treatment and collect 16 of it. And he has since gone on to be, and he's currently doing 20 plus appliances per month now. So the reality that he took advantage of is that if you're in control of the number of sleep opportunities that you're able to see and close on every month, then that gives you options as to how you structure your work-life balance as it pertains to general dentistry, whether you want to do sleep, whether you just want to pull back from everything and practice sleep as a hobby and still pay some bills or have some fun money. The reality is you have to have a system in place. So go ahead, click that button somewhere around this video and check out that training, and you can actually start implementing what you learn on that training today. So hopefully we'll see you on the inside. God bless.